So what I always say is current presentation, the answers often lie in the past. So about 24% of school-age kiddos are said to have some sort of tic, either a motor tic or a vocal tic. It's like a release valve. When they do that tic movement or that vocalization, it relieves that pressure, so to speak, in the brain and allows them to relax after the tic. I hate to say we go back to the thing that so many of us are saying these days. Post-COVID really has increased what we're seeing in kiddos, especially with regards to different areas of brain development that are not maturing like they should. The nervous system regulates the immune system. So when the immune system / nervous system is weak, individuals might not be able to handle an infectious load. And that chronic infectious load or chronic inflammatory load might linger, which we're seeing post-COVID in adults and in kiddos. Tourette's syndrome is very much associated with poor sensory processing. The microbiome is pretty much involved in everything. The microbiome is starting to be a big role player or something to look to with regard to overall brain development, neurodevelopment, and associated with tics, especially areas of the microbiome and the development of the cerebellum and the hippocampus and the prefrontal cortex and all these key areas that are involved in sensory motor development. If we can help regulate the sensory input coming into the brain from our joints, our muscle spindles, from the spine, from the extremities, that input coming into the brain